Dr. Turner, welcome to Mind Body Peak Performance.
Hello, I'm so glad to be here.
Glad to have you as well. Let's start off today with what you've done, the non-negotiables and essentials for your health and performance.
Right now, my sport of choice is powerlifting. I've done that about 2 years. It started during the pandemic, and it was the only gym that was available. The one I was working in before was closed because of COVID. So this gym would allow you to meet with one person and one trainer 2 or 3 times a week. So I started going to this gym and just really loved it. I think I like the competition with myself. You know, every day you can lift a little bit more weight, you get a little bit better. It gets you out of your brain and into your body, which is difficult for me to do on a daily basis. So that was good. The technical challenge of doing something like powerlifting, you know, every single position of every part of your body matters, much like golf. Yeah. That if you don't do everything exactly right, you will not be able to lift that weight. But if you do everything right, it'll be easy. So especially when you get to heavier and heavier weights, it makes a big difference. Your form is so critical and the risk of injury is so great. So that's what makes powerlifting fun. And then it's just a daily challenge just to myself. This is where I learned how much recovery matters because boy, if I'm not recovering, then I can't lift the next day in the gym. And the first place it shows up for me is in my grip. So things like trying to lift a bar, like a deadlift, for example, I can lift the weight with my back or with my thighs or whatever, but I can't hold on to the bar. That's the first thing to go. So it's interesting to see how much recovery is important. And moving from 2 days a week to 4 days a week as I get more competitive, now it's even more critical recovery. So things like sleep, eating correctly, taking all the things. I think probably my most beneficial, there's a lot of things. Sleep is really critical. If I'm not sleeping optimally, that makes all the difference. I take a growth hormone secretagogue, which there's a lot of people are familiar with these, but these are injectables. And I do those. That's, I think, probably the best recovery for me for getting back to the gym. I think any of the anabolic steroids are helpful. So estrogen as well as testosterone, I use those as well, also for improving recovery. But I think really the growth hormone secretagogues are my ally in getting back to functioning the next day in a better way. I use oxytocin. I use quite a bit of intestinal health supplements. I use a quality probiotic, a quality prebiotic. I use glutamine, L-glutamine. Every day it's different. So on my off days, I use things like Primadine and rapamycin.
Oh, okay.
And that's probably the big bulk of what I do. I mean, and it changes week to week and it changes month to month. Probably somewhat related to my following the shiny ball. Yeah. You know, oh, look at this new supplement. Oh, look at this new supplement. I should try this one. I'm sure you have the same thing.
Oh, yeah, I can relate. And I want to bookmark that to come back to oxytocin and the growth hormone secretagogues and the other hormones for later in the conversation. But first, I want to comment on, I love that you're part of the muscle-centric medicine camp.
I am, definitely. You can't survive without doing resistance training. I think that we undervalue that for people as they age. I think that the myokines, or the chemical messengers that exercising muscle sends to the body, gives it the signals of youth that it needs to maintain the DNA transcription of a youthful person. And I think as we age, we tend to do less and less, even things like we tend to use our hands to get up from a chair instead of using our thigh muscles. We tend to sit on the bed to put your socks on instead of standing and balancing on one leg to put your socks on. There's so many small examples of that we tend to not push ourselves to do that. I had a hip injury. And so I was trying to, I challenged myself to put my socks on without sitting on the bed. And so now after several months of trying to do that, standing on one leg, the hip injury has recovered to the point where I can now stand and put one sock on without. I know that sounds small and insignificant, but what you're trying to do is first of all, maintain that balance side to side, but also maintain the muscle that is able to do balance.
Yeah, I get that. And I also appreciate that you're noticing the little things. Like that's what it was for me also. I noticed that, okay, if I get a little less sleep, then my grip strength fails first when I deadlift. And all of a sudden I can't perform simply because my grip isn't functioning normally. And all I have to do is do something simple to perform the way I should be.
Yes, exactly. I could use wrist straps that would help. And I do on those days, but the grip being weaker is my first sign that this should be a reps day, not a max day, not a max out day. So that can help me to do the other things that I need to do, my smaller muscle, accessory muscle exercises. But it means that with my bigger lifts, I have to lower the weight and increase the reps for that day. Yeah.
And I heard a quote one time that if you're not increasing your lifts by 1% each session, you're probably under recovered.
Yes, that's probably true. Yes. Mm-hmm. And so I know this is my big travel and teaching season where the weekends are mostly taken up by either preparing for or actually doing conventions, medical conventions. So I know that my recovery is not going to be as good. I'm traveling in planes. I'm sleeping in hotels. I'm not eating as healthy. I'm exposed to herbicides and pesticides at the hotels. I mean, why are they so beautiful and there's no bugs in a hotel that has these beautiful things? It's because they use a lot of herbicides and pesticides. So when I'm exposed to all of that, I know that that's a time when I'm not going to be able to push myself, increase to 1% every time. And I'm going to have to back off of my heavier lifts for that period of time. So this is my season for focusing on teaching.
I want to ask you about your travel hacks, but this will turn into a long conversation in which we don't even get to the core topics. So today I want to talk more about root cause medicine. I want to talk about your preventative strategies, some of your favorite molecules and supplements and all that stuff. But first, how did you get interested in and involved in this industry to begin with?
So I was regular family medicine for probably 5 to 7 years, owned my own practice and saw patients on a pretty hefty schedule, 30 plus patients per day, and was working long hours, nights and weekends. And it was my own practice. So that was what was going to happen, was working long hours. But patients were coming to me I had one particular patient that came to me with her bioidentical hormone prescription. And I said, I don't know, what is that? And she said, well, I get it from this compounding pharmacy. So I sent the prescription to the compounding pharmacy and he called me up and said, hey, it looks like you don't know what you're doing. So can I send you to a conference? He actually offered to send me to a conference. And it was just a local small conference called Get Out of Line. And effectively the concept of if you're the last guy in line, all you see is the hind end of the dog in front of you. And so that's the theory of the allopathic medicine in general right now is the lack of continuing education. Every time I hear a dose of a medication, every time I start using a new therapy, I'm going to go and do the research to back up what's going on. I'm going to check into the dose that's recommended and why that particular dose is recommended. I'm going to see how it works and is there any other way I can use it in another patient who might have a completely different disease process. So my continuing education is every day. I spend an hour to 2 hours daily doing research on what's going on and patients and what's new in medicine, always looking for the next best thing. I'm sure much like you do in the biohacking community, always looking for what's going to help my patients. So that, I think, is an unusual trait of most allopathic doctors, not 100%, of course, but most of them don't spend the time they do whatever's told to them in medical school. And we have to remember that medical schools are really supported by the pharmaceutical industry, supported by Medicare, which is all about maintaining the patient's health, adding additional drugs until the patient goes away. I recently read an article from my own organization where they talked about pre-diabetes and whether or not we should be treating pre-diabetes as a disease state. There was a study that came out in 2014 that said that for every point above 87 that your fasting blood sugar goes, your risk of developing diabetes in the next 10 years goes up by 6%. So wow. Everyone in the United States believes that, or most doctors believe that a fasting blood sugar of less than 100 is normal. Well, if you believe that study, the fasting blood sugar of 100 means that you're at a 60% chance of developing diabetes in the next 10 years. My math isn't accurate on that, but it's a lot. Yeah. You're at quite a big increased risk of developing diabetes in the next 10 years. And so why would we wait till your fasting blood sugar gets over 100 before we begin the treatment? Well, this research study that came out of my organization said, unfortunately, you would have to treat patients for 7 years to prevent three patients from getting diabetes. Wow. And treatment meaning exercise and lifestyle. And I said, there's no additional benefit of treating people with exercise and lifestyle besides prevention of diabetes. I think that's not true. Yeah. I think we're missing a whole big chunk of patients if we treat them with exercise and lifestyle. Boy, think of all the things we would save them from dementia, from heart disease, all the things we would save them from orthopedic injuries, et cetera. So I think there's a miss, there's a disconnect in the traditional medicine. And I think that we need to be aware that there's so much out there that needs to be focused on, that medicine is flying past, especially since the pandemic. Now that we've had so much access to information and people are sharing information so openly, I think that we're going to see that light years are going by. Where it used to take 20 years for something to come to a physician in the office, I think this is going to start coming, same day, next day. Yeah,
all of the classic pillars of healthy living: diet, nutrition, hydration, movement, sleep, stress reduction. Those are all magic bullets that aren't that magic, meaning they take work, but they have the biggest impact, more so than a lot of the fancy new things coming to market do.
You got it. Exactly. And if you're not doing all those things, none of the fancy new things work well.
And if you do those things, then the fancy new things also work better.
Yes, we have a patient who she was on one of the therapies that we use for weight loss, and she lost 100 pounds. I mean, think of the life transformation when you lose 100 pounds. Not only the social transformation that may occur just because of how you feel about yourself, but the ability to move, the ability to function, the overall health risk reduction that can occur. I mean, 100 pounds is enormous. If she had not been exercising and changed her diet, she might have gotten 30 pounds, which would have helped. It would have been a big transformation for her. But imagine the 100 pounds transformation that occurs.
Yeah, I know from personal experience, I'll often take a backpack and put 40, 50, 60 pounds in it and go for a nice long walk. And after an hour or two, pretty exhausted. So I can only imagine having an extra 100 pounds and walking around all day, what that does to your bones, your tendons, your ligaments, all kinds of things throughout your body. And then once you remove that, how much lighter and more energetic and more free you feel.
Yes. And what a good exercise for you to do. That's great.
Yeah, it's a process called rucking, and it's used a lot by the military, and in my rugby training, we did that also. When I travel and I don't have access to heavy weights, I'll do that, and I'll feel like I got a good workout in.
I bet. That's great.
One thing I want to talk about is how you go about finding a medical specialist, a practitioner to work with you who is more open to alternative therapies and modalities and has getting to the root cause at the forefront of their agenda.
I think there's several ways you can do that. I think that you can, thank goodness we now have so many resources at our fingertips. But I think that you can do, there are several big organizations that are respected in the community. A4M is one, IFM is one, AIHM is one, and ACAM is one. These four all have directories of providers, and you could search their directories to find providers that are in your area. They usually have a map that pulls up and you just find someone that's in your area. Depending on what specialty you're looking for, obviously you can use Google to look for whatever specialty. So if you're looking for a Lyme disease specialist, or if you're looking for thyroid specialists, there are different people who specialize in those things. And there are people, doctors in every state. So there's no reason why you shouldn't be able to find someone who can at least help.
Yeah, okay. I will put the links in the show notes because those are just a lot of acronyms that might be glossed over. In your own practice, what are the most common or most crucial tests you do to evaluate new patients?
That's great. So I really believe we did not miss the mark with the very simple LabCorp and Quest labs. I think you can learn a tremendous amount from a patient from reading their CBC and CMP, which are the basic labs that most doctors order. So I'm always going to start with those two labs because there's so much richness there that you can learn about a patient. And they're really inexpensive. Most of the time, $3 for each test.
Wow.
So even if that's all I have a wealth of information. So in talking about researching, again, your functional medicine doctor is going to have gone back and researched what each of those items means, and what a normal for that lab should be, or an optimal for that lab should be. So I'm going to be able to tell you, for example, that an albumin is a marker of aging and disease, that if your albumin is less than 4.5, that you probably are more likely to be more ill from any cause, COVID, heart attack, cancer. You're more likely to be more ill from it if your albumin is less than 4.5 at the outset of your disease. And the progress of that is really valuable. So watching over time the change in that level. And that's easily improved by increasing resistance training and by increasing protein intake in your diet. And of course, that all depends on your age and lots of other factors, and every person is different. The other labs that we use commonly, in addition to those very simple labs, are a full thyroid panel. So we're going to look at several different markers that a lot of primary care or allopathic doctors don't use, and looking at your free T3, free T4, reverse T3, looking at the antibody levels, because we're trying to figure out exactly what's happening. And a plain TSH doesn't give us enough information. There's lots of things that could be going on that we don't know, that a plain TSH doesn't give us that information. And the optimal range for each of those labs also needs to be paid attention. We do several other labs in that basic category. We'll look at CRP, we'll look at homocysteine, we'll look at a full hormone panel, including your cortisol and adrenal hormone DHEA. We sometimes will look at that in a saliva test. So the cortisol we can do in saliva, but depending on where you are in your life cycle. So premenopausal, postmenopausal, where you are in your menstrual cycle, or if you're a man, of course, that's a different category. We can look at that in urine too, and that gives us a different information because it it tells us what's been processed already, because urine is a byproduct. So anything we find there has already been handled by the body and processed. So in a perfect world, you would use all three of those modalities and be able to really get an idea of how the patient's doing in all three areas: blood and urine and saliva. And then you can compare those. We also will do things like there's several labs that do a stool test. Vibrant does one, Genova does one. And those tests give us a lot of information about what the makeup of your microbiome is. We call the microbiome is all the different bacteria that live in the colon that are typically symbiotic or helpful to, or sometimes pathogenic, not helpful to us as human beings. But there are several bacteria that help us to process a lot of nutrients that we take in and convert them to things that we can use to optimize our health. So that's a really important thing for us to know, is how are those nutrients that we take in being metabolized by the bugs that live in our intestines. And when we have a healthy microbiome, we get great results, anti-inflammatory, and all the things we need. When we have an unhealthy microbiome, those nutrients get processed in a way that is inflammatory and pathogenic, potentially pathogenic. So knowing that information can be really helpful. We can also look for things like, do I have enough digestive enzymes? Do I have enough butyrate, which is the preferred fuel source for your colon cells, your intestinal epithelial cells? Do I have enough of some of the other byproducts of the bacteria, like beta-glucuronidase, that helps you to process things like estrogen to remove excess estrogen, or especially in men, we want to look for that removal process. And so treating the microbiome can be really important. We look for micronutrient testing. So as opposed to drawing, for example, a B12 level in your blood, we can actually do a B12 level that's inside the cells. So I care about what's in your blood. That's important. But really what's down at the root is, how well is that nutrient getting to where it needs to be used? Is it getting into the cell? Is it getting into the mitochondria where it can be used in various processes? And so there's ways we can test for that. There's several labs that do that. Vibrant does it. SpectraCell does it. And they can tell us what's Genova has one as well called a NutriVal. That can tell us what is the cell actually doing with that nutrient, and is it being used properly, and are the nutrients, are the enzyme processes that need that to have it to happen, are they functioning properly? So micronutrient testing. We do some food allergy testing. These are a little bit more difficult to translate. When I see a patient who has 20 or 30 food allergies, I say, you know what, this is probably not a food allergy. This is probably intestinal dysbiosis. And we go back to the intestinal testing, because there's not really a reason why you should have several food allergies. If it comes back that you have one or two, dairy or wheat or something, food allergies, then no surprise, that's something we can address. But again, if it's multiple food allergies, this is not a primary food allergy problem. This is a primary intestinal function problem. And we really need to start addressing that and looking in that direction. We can do lots of things looking at are you done? Is that enough?
No, I'm enjoying this. Continue.
There's lots of things we can do looking at the brain and brain function. There's some antibody tests that are really interesting, looking at has your body created antibodies against its own blood-brain barrier, for example, so that your own body begins to attack your own blood-brain barrier. Obviously, that would be a problem, because you would allow toxins and infectious particles to go into the brain and create more problems like brain fog, memory loss, etc. So we can look at those things. And then if you're talking about specific disease states like Lyme or mold, for example, there's a whole bunch of labs we can do there that look specifically at not only is the disease present, but also what is the disease, what are the associated disease states that are going along with that. So do I have Lyme? And not only do I have Lyme, but do I also have the chronic inflammatory response syndrome, or we call it CIRS? Do I also have that state where my genetics are such that I'm predisposed to becoming very ill from these, from Lyme disease or from mold or lots of other Ciguatera, other causes?
Do you run any heavy metal testing or hair mineral analysis?
Absolutely. So, especially if you have a job where you're exposed. So, I have some jewelers that come to me, and they of course are exposed to lots of heavy metals. Some painters, a lot of the older paints were made with cadmium, lead, etc. Some metal workers, like an automotive worker would probably have some heavy metal exposure. A dentist would have some heavy metal exposure. So people who certainly have those, and then anyone who has metal fillings on the biting surface of their teeth is going to be at more risk for heavy metal exposure. So definitely, we do some of that in the hair. Hair is difficult because most of us have some sort of product in our hair, like shampoo. Shampoo usually gets washed out, but any of the products that you're going to use, any conditioner that you might leave on would stay in there and would affect the results of the test. So yes, we do use hair. The nice thing about that is it gives us about a 3-month average. So as opposed to drawing your blood today, where we get a single sample for today, a hair specimen is going to give us, a 3-month exposure or longer exposure, which is a really good opportunity. But you're also running the risk of confounding variables like conditioner or shampoo or something like that.
What would you say the overview, why is it so important to run these diagnostics and do early treatments and interventions and get to the root cause?
When I used to treat high blood pressure, we used to say, oh, you have high blood pressure. Here's your high blood pressure medicine. I'll see you in a month and we'll treat your high blood pressure and we'll make sure that this medicine is correct. If it's not correct, in a month when we bring you back, we'll just give you another high blood pressure medicine and we'll keep going until we get your blood pressure down. Now, I try to figure out, why do you, as my patient, you, Nick Urban, for example, why would you have high blood pressure? Is it because of heavy metal? Is it because of alcoholism? Is it because of Motrin, Aleve, Advil, ibuprofen use? Is it because of high salt intake? Kind of related. There's a lot of variables there. Is it because of genetics? Is it because of renal artery stenosis? Is it because of a pheochromocytoma? Is it, there's so many pieces that go into this. Is it a sedentary lifestyle? Is it because you have quite a bit of stress in your life and your cortisol has gone up? So now your blood vessels are contracting and your elevated blood pressure. There's so many possible reasons that we can go through to help figure out why. If we treat that, then we don't have to use the blood pressure medicine. Now, the blood pressure medicine is $3, and all the figuring out the why is a lot more expensive. Yeah. But we're actually treating the reason as opposed to just putting a Band-Aid on the problem. And I think that's a better way to go, because if I can get to the problem, I'm probably preventing a lot of other things on the way.
Yeah, it's just a symptom and there's probably other things going on as well.
Exactly. And when you treat the one thing that might be causing the problem with blood pressure, the blood pressure is just a symptom. So if I treat the one thing that might be causing the blood pressure, for example, your alcoholism, then I actually treat so many other things: the associated liver disease, the associated heart disease, the associated skin collagen loss. There's so many pieces that we correct if we correct the root problem. If I just give you a blood pressure medicine, I'm not preventing any of those things from happening.
Mm-hmm. Dr. Turner, you've mentioned a couple that we're both fans of so far, such as resistance training and consuming enough protein as some early interventions that you like. Are there any others that you find you use most common in your clinic?
I think there definitely needs to be enough protein. I think that's particularly relevant over the age of about 40. We have to keep in mind that there's a different physiology over the age of 35, 40 versus under the age of 35, 40. So under the age of 35, 40, I'm going to have you follow a primarily plant-based diet. Now, that doesn't mean you're not going to be taking protein. It just means protein won't be your primary focus. You'll be doing primarily plant-based. Over the age of 35, 40, and where that marker is very individual dependent, and we will find that together. But on average, over the age of 35, 40, we begin to increase the amount of protein that you take in because your needs and demands go up, especially if you're an athlete. That needs the demands of that go up. For protein intake go up. The timing of those nutrients is also very critical. And this is something that my friend Sumi, who's a dietitian out in California, encouraged me about. The timing of nutrients before and after workouts, before and after or around sleep, around activities, around rest is so important. So getting all of those little pieces in place for you as a unique individual is really critical. I think having someone be involved in your care, if you can, like a good dietitian who's used to working with athletes, is really worth every penny that you spend.
One other thing we talked about previously was surgeries, and you're a human performance specialist. So what do you recommend to people either to prevent needing like orthopedic surgeries in the first place, or alternative routes they can go down if they think they might need one soon and they don't feel ready yet to take the plunge into a long recovery time like that?
So this is where something I'm really passionate about. I think that we tend to say, oh, it's just a minor injury. I'm just going to wait on it. I just pulled my thumb doing whatever I was doing. I just tweaked my knee. I'm not going to worry about it. It'll get better in 2 or 3 days. What that sets up for you is an inflammatory cascade that begins. It probably will resolve, but then a couple of years later, you do it again. You re-injure the same place because it's weaker than it was before. So now you set up this inflammatory, and now it's a little bit longer, prolonged state of injury. It's a little bit more difficult to recover from that injury. And it happens again and again. And then we end up in the place where we have osteoarthritis of that joint, and we can't recover from that original injury. If instead we start with the original injury and treat it with, there's lots of things we can do. There's lots of peptides we can use. There's lots that we can either inject into the joint, that we can inject around the joint. We can do sub-Q. There's some oral therapies you can use. BPC 157 is available over the counter now. You can use that orally, especially around an injury, to help recover. I just think it needs to be done so much earlier instead of us ignoring it and saying it's just going to go away in a couple of days. So especially my really young athletes, I'm saying, hey, if you get any injury, please go ahead and start using your BPC or your KPD or your TB4 or whatever the thing is. If it's a little bit worse injury than you were expecting, or please come in and we'll do some injections to get you better. Some of these recovery, repair peptide things we do to help you to get past this, because osteoarthritis doesn't just start when you're 60. It starts with that first injury when you're 20, when you're 16. And then it progresses to the point where if you come to see me when you're already bone on bone, a lot of the things I would normally do aren't as effective. So come see me when you're 20 or 25 or 35 or 40, before it gets to the point where it's so far gone that now the only option you have available to you is surgery. The growth hormone secretagogues are a great way for us to recover from those injuries more quickly. They get the system running. They get the repair molecules happening. We can use things, growth factors or acellular growth factors. We can use those also to help with recovery. So there's lots of things we can do early on, and the earlier we catch it, the better. So don't think, I'll just wait. Go ahead and get treated as soon as possible, because those surgeries can be prevented. So then if the patient is thinking about having surgery for whatever reason, there is a pre-surgical and post-surgical protocol that we go through with them, both dietary and peptide related, to improve their recovery rates. And the orthopedics around our area are always surprised to see how quickly their patients recover. And they're like, hey, you probably need to go see that. She's a little woo-woo doctor over there, but our patients get better so much faster when they follow her protocols. So they will come and see us. We'll treat them before and treat them post-surgical. We have to remember that anesthesia does affect the brain. Yeah. And so any exposure to anesthesia is going to be a setback for your brain. I remember when my husband went through knee replacement surgery, both times for about 3 months, there was not detectable to anybody else but his wife, but there was a noticeable decline in cognitive function for 2 or 3 months. And so being able to get him to recover faster from that, particularly the second time we did this together, we were able to treat that recovery a little bit faster. So he was able to come out of surgery without the difficult recovery time.
So what you're saying is that if you have an injury, it's good to take the rehab seriously, perhaps look at therapies to recover from it faster. And I noticed from my own observation as a kid that my friends who got hurt would tend to injure the same parts of their body over and over again. And it was like a never-ending loop.
Yes. Yep. And if you get that treated sooner than later, then the chance of recovering there is better. There's lots of interesting things that we do now, specifically with chronic injuries. There's a whole study of therapy that's been around for centuries called neural therapy, NEURAL therapy, where they use a drug called Procaine, or you probably know it as Novocaine. And they do injections around the site that also can be really helpful, especially for chronic injuries. There's really no reason why that particular area should have chronic pain. The chronic pain is produced by a feedback loop to the brain that's not allowing that inflammation to settle down. So it's not necessarily a specific injury that's persisting as much as it is a nerve loop that's being constantly triggered. And this can happen because of the immune system that surrounds that nerve as it travels from the site of injury to the brain. That immune response can persist unless it's treated and broken.
Wow, that's interesting.
Mm-hmm.
So that's a way of quelling inflammation that probably makes sense. And it's not the same as just taking a painkiller that indiscriminately blocks the inflammation.
Exactly. Yep.
That's closer to the root cause.
You got it. Exactly. I have a friend out in California, Dr. Matt Cook, who does what he called, are you familiar with Dr. Cook?
Yep.
He does, he's with BioReset Medical. He does what he calls hydrodissection of the nerve and frees it up from the nerve sheath and then injects the peptides right into that nerve sheath. So he does that under ultrasound guidance and has some really great success stories with some chronic injured patients. So those are, again, don't ignore the chronic pain, get in and get those treated.
Yeah, I get how that works now. It all makes sense.
Mm-hmm.
For the growth hormone secretagogues and I guess the endocrine system in general, is it safe to use on your younger athletes like you're mentioning?
Oh, absolutely. Absolutely. Those are things I'm going to check on patients. You can't be, one of the reasons why I love using growth hormone secretagogues is you can't overdose them. If I'm using straight growth hormone, there's a good chance of overdosing because you, especially in a young person, you're already making a lot of your own, or should be already making a lot of your own growth hormone. So if I'm giving you a growth hormone secretagogue, we're causing extra trouble. If I can give you the growth hormone secretagogue, we can actually improve that recovery. And what we're talking about is getting down to the cellular function, getting those cells to choose to use fat as a substrate, the mitochondria to be optimized, the cells to increase their production of mitochondria. So, there's not just one mitochondria in every cell. There can be hundreds of mitochondria in every cell. And so if we can improve the number of mitochondria per cell by using growth hormone secretagogues, this is a win-win. So patients will get really great recovery and results from using those.
Okay, so now we're obviously transitioning on to the peptides, the bioregulators, and the small molecules. And along that same line, for the growth hormone secretagogues, I believe there's like two main classes, the growth hormone releasing peptides, is it? And then there's one other. And do you need to stack them together?
Absolutely. So we use any of the growth hormone. They both work slightly differently. So the growth hormone releasing hormone is one category, and that's the familiar names that you may have heard of is like CJC 1295. Tesamorelin is a common, a familiar one. MK677 is a little bit different, but it's also, so that actually falls into the growth hormone releasing peptide, which are typically somatostatin inhibitors. So hair complicated, hang with me for a second. In order for growth hormone to be released, we have to release the brake, and the brake we called somatostatin. We put that brake on. Somatostatin gets put on for all kinds of reasons to prevent the release of growth hormone. Usually growth hormone is secreted in your body about 7 to 10 times a day, depending on what, women have smaller but more frequent peaks. Men have shorter, larger but less frequent peaks. So in between those releases of growth hormone, will have somatostatin in place. In order to release somatostatin, we use these ghrelin agonists, which is the growth hormone related peptide, releasing peptide. And those, it will cause release of somatostatin from the growth hormone, so allowing the release of that. Interesting things. One of the reasons we ask patients to be fasting when they use growth hormone secretagogues is because fat and carbohydrates encourage the somatostatin to be put in place. So that brake to be put in place. So if you're giving something to remove the somatostatin and something to put it's counterproductive. Yeah. So the reason we ask people to be fasting when they take those is because of that piece. We usually will stack them together, and then we also do them in cycles. So we'll do them in 5 days on, 2 days off. We'll also do them in 3 months on, 1 month off, or 2 months on. Depending on the person. I'm a big fan of the 40 days. I think there's a reason why God gave us 40 days of all kinds of things. And so I use 40 days as my general rule of thumb for most people. It's tough when you get people on growth hormone secretagogues because they really don't like to come off of them. So we have to find ways to play with them a little bit so that they can come off of them and do better. There is another one called sermorelin, which is growth hormone releasing hormone agonist. And that's probably the one that's most available right now.
Yeah, I know that when I took MK677, I didn't stack it like I should have, but I noticed that I slept much better. And a side effect I didn't love was that my appetite was even higher than it usually is, which is already pretty high.
It's a pretty big jump in appetite. Yep. It's wonderful if you are trying to gain weight. That's not always the case. And I don't usually use that in my female athletes, but I do definitely use it unless they're, it depends on where they are in their training cycle. And of course, it depends on their sport. But MK is not the one we do because it does have quite a bit of appetite stimulation. The others don't have the same appetite stimulation, so they're a nicer pairing. And most of them help pretty significantly with fat loss and muscle growth. So that's pretty difficult to achieve on your own with exercise and diet. Fat loss and muscle growth, we often will see patients will lose fat, but they'll also lose muscle. So to be able to do both, it often requires some additional outside manipulation.
Yeah, it's hard to get the full body recomposition that people are looking for because, like you said, it's usually one or the other, but rarely both.
You got it. You got it.
You mentioned something earlier that people may or may not have heard and their ears perked up, but you said that you take oxytocin. And yes. I have oxytocin, I think it's acetate, and I've used it a couple times, but I'm curious why you use it.
Do you use it sub-Q or intranasal, or how do you use it?
Intranasal.
Okay. So I started being interested in oxytocin for its anti-anxiety benefits because I'm trying to find what can I find to help patients with their anxiety that is not a benzodiazepine. There's so much negative research on brain health and benzodiazepines. And so oxytocin came up as one of the options. As I continued to study this more, so this is such a fascinating molecule, and most people know it as Pitocin that women use during labor and delivery to augment labor. But this chemical is naturally produced by your brain. It's the cuddle hormone. A lot of people study it as the cuddle hormone because it does increase your desire for closeness. So it's a great one to use for social anxiety. If you have a social anxiety, all of us coming out of the pandemic probably have a little bit of social anxiety just because we're so not used to being in big groups of people. So this is a great option for that. And it's available sub-Q, IM, intranasal, troches. We use it in a troche that, if you're familiar, troches are like a gummy sort of that gets put between your upper gum and cheek and dissolves, takes about 20 minutes to dissolve. We mix that with a little bit of L-theanine and that's a really nice, calming, anti-anxiety, or helpful for sleep or therapy. The interesting thing was learning how beneficial it is, the research that's come out about it being used actually in humans for weight loss. So the weight loss dosing is 4 times a day before meals. And that can be given intranasally or sub-Q. And then and in the studies, that's how it was done. And then the other interesting piece is the muscle building benefits. So the post-workout recovery benefits. And again, I consider it's not that that itself causes the muscle gain, but it improves recovery. So you can go back to the gym again and build that muscle on your own. So if you sit in a chair and take oxytocin, it's probably not going to cause muscle gain. But if you go to the gym and you take oxytocin, your muscle gain will be present, will be visible.
Yeah, I used it to connect with my partner on a deeper level. So because of the trust and connection that it facilitates, it's probably not the best thing to take when you're going to go about being around strangers and used car salesmen and that kind of situation.
That is a good point.
It's a cool one. And when I was looking through the research on it, I had a hard time pinpointing the right dose for intranasal. Okay.
So I think there isn't a right dose. I think it's very individual dependent. For me, it runs around 40 units. So I do a 20 unit per spray, nasal spray, and I do 1 spray per nostril.
I see. In general, with these compounds that have research, but it's oftentimes in animals or in different patient populations, how do you go about finding the right dose for yourself?
I have some of it's trial and error. I do a lot of trial and error on me or on my husband, depending on what I need to know. And he says he has a little cat dish on the counter in the kitchen, and he just takes whatever is in there. And then afterward he goes, "So what was that I just took? What was in that shot I just gave myself?"
Thumbs up or thumbs down.
Right, exactly. Cyanide. No. And so, in talking, how do you figure out the right dose? So most of the studies that are done I try to find any studies that are done in humans. That's really where the goal is to look for the human dose. There are charts you can find that will give you the human equivalent, how to figure out what the human equivalent dose. There's a big study that was done several years ago that tells you if it's a rat, if it's a horse, if it's a cow, if it's a dog, how to do the calculation for the human equivalent dose. And that's not perfect. It's somewhat of a guess. And so when you're doing this, that's why ideally you would find the best studies that you can. If all you have is mouse studies, that's probably the way we go, is follow the mouse studies and then do the conversion to a human dose. So a lot of times, for example, a lot of the research with epitalon or epitalon, however you pronounce it, the bioregulator, if you look at the studies on the difference between the injectable and the epitalamin, which is the oral or the cytomax. I think that's what they call it. The dosing is 10 milligrams per day versus 1 milligram per day. And I think it really depends on which one you're using. So you have to really look into the studies and see what dose they used, and then do the mouse to human conversion. And I start on the low end of that and work my way up through that dosing.
Perhaps we should define what peptides and bioregulators and small molecules are.
Sure, absolutely. So peptides they've been around since they were discovered in the 20s. The first one was secretin. That's an intestinal chemical. These are strings of amino acids that your body makes to cause things to happen in your body. So let's say you need to make more mitochondria. In order for that to happen, you need to create the appropriate strings of amino acids to make that happen, either to be the enzymes or to be the substrate that the enzyme works on. So you want to create these strings of amino acids. There are lots of them. Oxytocin is one that we just mentioned. Growth hormone is one. People are probably familiar with insulin. That's one of the first ones that ever came out that was discovered. In about 2005, we figured out, I say we, I wasn't there. We figured out how to create these in a lab in a very quick way. Before that, they had to be created, they had to be taken either from a human or from an animal, from a cow or a pig typically. And that was, of course, very labor intensive. So the new way of creating peptides in a lab is much simpler, and you can replicate them, make large volumes of them so that they can be sold commercially. So now that's why we're hearing about them in the last 5 to 10 years, is because the way to make them in an efficient manner. And now we can make any peptide. So we consider proteins to be greater than 150 amino acids long. So again, strings of amino acids that are greater than 150 amino acids long, we consider those proteins. From 50 to 150 amino acids long, we call them polypeptides. And anything under 50 amino acids long, we call peptides. Bioregulators are peptides that are less than 4 amino acids long. The cool thing about bioregulators is they can cross blood-brain barrier, they can cross cell walls, they can cross mitochondrial walls and get to where they need. They can usually be used orally. They can get to where they need to be used and be very functional. They're ubiquitous. We have them in our bodies naturally, but they are being discovered daily through artificial intelligence means to figure out which of these small strings of amino acids do what things in the body. And as new ones come out, there's new ones every day. It's such exciting work. They actually bind to our DNA and change the way that DNA is expressed. So your genes become expressed into proteins, and those proteins do different things. Well, this little tiny string of amino acids that's 3 or 4 long will bind, or 2 long, some of them are 2, will bind to your DNA and turn genes on or off. Most of the time, they're related to aging. They're related to a more youthful production of that gene, or turning off the more aging version of that gene. So it's pretty exciting to all the science is coming out every day for new things and new ways that we can use them.
Yeah. And to contrast that with pharmaceuticals.
Right. So most of the pharmaceuticals have some sort of modification. They are a synthetic version, not what your body normally uses, that will stop an action from happening. So for example, you have an enzyme that causes you to, you have an enzyme that causes you to make a receptor for a hormone, for example, and you don't want that hormone to be causing the thing to happen. It'll bind to that receptor and prevent the real hormone from binding. And then you don't get the entire cascade that may happen from that hormone binding to the receptor, because it just blocks that hormone from binding. There's lots of ways that pharmaceuticals work, but they often are not compatible with the body, and they often will cause more damage or more harm. Birth control pills are a perfect example, with the progestogens or progestins that are in birth control pills binding to the progesterone receptor, not causing anything to happen in the cell. Now, they're awesome because they prevent you from having pregnancy, because that's what you want, but they also prevent you from having all the benefits of wonderful progesterone. So unfortunately, they're a shotgun way to treat something that probably will prevent you from getting the benefits of that therapy.
I'm sure we could do a whole podcast just on women's health, but the way I tend to summarize it, I could be wrong, but pharmaceuticals force the body to do different things via pathways and enzymes and that kind of thing. And then peptides and these smaller molecules suggest but don't actually force.
It's beautiful.
Like, if you were to treat someone with an injury and they wanted to recover faster, what would you suggest they look into?
There's several peptides that are out there. In a perfect world, they would have already been on a growth hormone secretagogue of some sort, cycling some sort of growth hormone secretagogue. And they would also have already been on a lot of the repair peptides. So the thymosins, BPC, all of those have some repair evidence in not only in animals, but also in humans. There's some evidence of recovery and repair using the GLP-1s, the new class, that is a pharmaceutical. They are available pharmaceutical. And a lot of peptides are now coming out as pharmaceutical options. So just be aware that there may be a pharmaceutical that is available that is a peptide.
Cool.
So in a perfect world, those patients would already be on some sort of therapy that would be helping to get them to recover very quickly, because they would already be there. But we would double down on their dose, or we would give this specifically into the tendon or joint or area of injury, and in a higher dose than they would already be taking. So these patients would be recovering faster because we would be giving them some thymosins or some BPC directly into the area of injury.
You've convinced me to dust off my old secretagogues and run a cycle of that again.
Mm-hmm. I think it's great to cycle them. I think they work really well cycled, definitely.
How about for something such as cognition? Anything there that you like?
Absolutely. When a patient will come to me for the first time with cognitive problems, there are lots of things we can do. I think one of my favorite things, obviously you have to do all the things. You have to do the diet, the nutrition. That's really difficult when patients are in an assisted living facility. So ideally we would start, again, very much like I mentioned at the beginning with orthopedic injuries, we want to start this treatment as early as possible. So if you're noticing in your 40s that you're not able to remember things quite as well as you used to, you can't hold on to lists like you used to, first of all, get rid of your cell phone if you can, because that's limiting your brain's ability to work, or you're dependent on the machine instead of depending on yourself. And you're not challenging yourself to remember things. So even starting with things like with remembering your family members' telephone numbers, instead of punching them into the as the person in the phone, if you dial the number yourself, I think that's a good brain challenge. But doing things that are new and learning new things, like learning music, learning how to dance, doing a new sport, for example, all of those are really helpful for brain function, because it requires both sides of your brain and will be a trigger for stimulating growth. If you're continuing to do the same things over and over, you're not triggering any growth of new brain cells. As far as therapies go, there's so many that I think are helpful. I think all the things we talked about, the thymosins and the growth hormone secretagogues, even things like GHKCU can be really helpful for brain health. But we need to not forget that the GLP-1s, things like semaglutide, dulaglutide, liraglutide, these all originally were discovered to be used in patients with dementia and Parkinson's disease. So that was their original discovery. We found out, oh, by the way, that they worked for diabetes and they worked for weight loss. So that's what we use them for now. And they were stopped in the dementia arena because their use was stopped because of the excessive weight loss in those patients. Yeah. So they've picked them back up again, and they're working on ways to modify the molecule so it can be used in treating patients with cognitive decline. But let's say you have a family history of cognitive decline. I'm going to use the GLP-1s as one of my therapies to improve that. Keep in mind that a cell is a cell. So this is why if I keep going back to using growth hormone secretagogues, to using BPC, the recovery is the same, not regardless of what the cell is. If we can get the immune system to calm down and we can optimize the way the cell functions so that it's using fat as a substrate, so that it's using oxygen and oxidative phosphorylation, which is the process by which the cell uses an energy source plus oxygen to make energy. If we can get the cells to function optimally, it doesn't matter what the cell is. If it's a muscle cell, if it's a tendon, if it's a brain cell, if we can get them to function optimally. So if you hear me say a lot of the same things, it's because the process is the same. That's why I call it cellular and longevity medicine, because the cells are where the money is regardless. So the brain specific things that we do, there's a peptide called dihexa that increases your BDNF, and you may be familiar with BDNF. BDNF is brain derived neurotrophic factor. This is the factor that causes your brain cells to grow and branch. And we want them to grow and branch so that they begin learning new things. If I'm going to put a patient on one of these, I'm going to say, hey, I need you to start doing something to challenge your brain. Learn a language. Learn to play the piano, some sort of thing that's new for challenging your brain. And then you can begin the brain challenge medication. There was an old brain health peptide called cerebrolysin. It was excellent for helping with brain health. It had lots of research backing it up. A few years ago, the FDA came down on us using cerebrolysin and changed the peptide definition to less than 43 amino acids, which then excluded cerebrolysin from being available. So unfortunately, it is no longer available to most of us. So that was available. I had several patients using it who did really well. And so we're looking for alternatives to that now. So that's available. Dihexa is available. I think anytime you can increase patients' NAD, you're improving their function as well. So you're going to improve NAD by using growth hormone secretagogues because you're increasing the number of mitochondria. You can use actual NAD, which is nicotinamide adenine dinucleotide. This is the energy source for all of your cells. It goes into your mitochondria. It becomes ATP. So we want to increase your production of NAD. You can give yourself NAD if you want to do it that way. That's an option. It's a derivative of vitamin B3. You can do NMN or NR, which are available orally. But you can also use, like I said, the growth hormone secretagogues, which will secondarily, by increasing the mitochondria, they will increase your NAD. But you also can use an oral. This is a small molecule, so it's not a string of amino acids. There are some amino acids in it, but it is an NNMT inhibitor. So NNMT is the enzyme that breaks down NAD. If you inhibit it, you're increasing your production of NAD, right? Yep. So it's a little more complicated than that, but that's the sort of simple way of thinking about it. So that is a great way to improve your NAD function, which will also improve your cells. If you have enough NAD, your brain cells then have the energy they need to do their jobs. So all of it's about supplying the need for the cell to do its job. There is also a peptide called VIP, vasoactive intestinal peptide. VIP will also raise your NAD because it turns on the clock genes. So your circadian rhythm is closely tied to energy production. First thing in the morning, your body naturally produces excess NAD because you need to have extra energy to get from sleeping to wakeful state and go about your day. So if you fix your circadian rhythm, obviously by sleeping, but an alternate way is by using something like VIP, then you can increase your NAD production as well. So the last thing we do is any of the things that are going to help with your immunosenescence or aging of the immune system. And that would be any of the thymosin, the thymus gland peptides that are available.
And those will improve your cognition?
Absolutely. Because part of the problem in the brain is the inflammation that occurs in the brain. So if we can get the microglia to calm down, then much like we were talking before about this chronic pain that's caused by the nerve conduction loop, same concept if we can get it to calm down. There's a small dipeptide called L-carnosine that's available orally that can help to block that loop as well. So that's another one that you can use. It's available over the counter.
Lots here. I think if you're up for it, we'll have to do another round where we talk about athletic performance, building the fully optimized athlete, and then also female health. And there's so much more we can cover. I love that you have a wealth of knowledge and wisdom on all this stuff.
Thank you so much. I've been really blessed to have some great teachers.
How do you go about finding your teachers?
Some of it is researching. Some of it is finding the person who is doing the research. You know, if you can reach out, most of the time they will have their email on their on the article, and you can reach out to the researcher. The other is you can see, of course, looking for. I do it the same way you guys do it, by looking through Instagram, looking through Google, trying to find whoever the person is that's doing something that I'm not doing. And so I go to whoever that expert is and say, hey, can I pay you to teach me what you're doing? And some of them will have a conference, or they'll do, a lot of those are available now where you can go to their conferences, like the new peptide conference that's coming up. There are lots of ways you can find good teachers.
Okay, well, let's start to wind this one down. But before we do, I have a question for you that I ask all guests. Are you ready?
Yes.
Imagine that there's a burning of the books and all knowledge on earth is gone. You get to save the works of 3 teachers. Who would you choose and why?
Number 1, I would choose the New Testament. I'm a Christian and I believe in what he has to say. I think the story is really valuable and relevant, and I think it's applicable to all of us, whether you believe as a Christian or not. I think there's a lot of great information there. And then that would be number 1. And then, who else?
We can also include conferences and other learning opportunities.
There's a really interesting relationship therapist woman researcher. Her name is Allison Armstrong. And she does some amazing work around relationships between men and women, but also relationships in the workplace, relationships between same genders. I think she has some brilliant work, and I would save her. Gosh, a third one. There's so many more.
That works. Perfect. Well, actually, that was the Bible and the New Testament have been the most popular answers on the show. So you're in good company. And then this year, I've been focusing a lot on relationships and connection. So that's a new one for me that I'll have to look into her.
Oh, she's great. She's very interesting. She's been on a bunch of podcasts, so it'd be interesting to have her on your show.
Yeah. Okay, we'll go on to a rapid fire round now.
Okay.
What area of your own health and wellness and performance are you currently working on?
I'm in the middle of trying to decide if I keep pursuing powerlifting or if I modify that to if I find a different sport. I've kind of reached where I can as far as my health goes, as far as my strength goes. And I wonder if I'm not sure if I can push past it or if I need to switch sports altogether. Some of that's related to my lifestyle in general. And if I was in a different place in my career, it might not be so. If I could take off 6 months, I probably could push past it easily.
Yeah.
So that's my debate right now is, do I shelf this for a minute? Mm-hmm.
What's been the best purchase of $500 or less that's had a disproportionate effect on your life?
Ooh, I would maybe say there's so many things. I love my Aura ring. Can I say several?
Yeah.
I love my Aura ring. Oh, $500 or less. I was going to say my car. That just wasn't $500 or less. I would say my Aura ring, my Microsoft Surface Pro.
Mm-hmm.
What else? Probably my Hyper Ice, the Theragun.
Oh, yeah. Good list. Okay, last question is, what is one thing that your tribe doesn't know about you?
That one of my favorite music genres is old school R&B.
Ah.
Mm-hmm.
Do you have a playlist we can put in the show notes?
Leon Bridges, Ray LaMontagne.
Uh-huh. How would you like to land this plane? Any final thoughts?
This is an evolving journey. This is an evolving science. So what I'm telling you today won't be applicable in a year. So just be aware that everything changes, and it's not the fault of your doctor, or it's just because everything changes. We're trying as hard as we can to learn as much as we can, as fast as we can. And you need to find someone who's working toward that goal.
Mm-hmm. Well, thank you so much for joining us today on the podcast. It's been a pleasure chatting. And to all those tuning in right now, I hope we've given you some ideas of things to look into for optimizing your own health, performance, and overall wellness. I'm Nick Urban, here with Dr. Suzanne Turner, signing out from mindbodypeak.com. Have a great week and be an outlier.